Some people who feel their sagging brow line is making them look tired and unhappy are turning to a common procedure. But what is brow lift surgery, and is it right for you? Board certified plastic surgeon Dr. Michael Kim is here with the information that you need. Good morning.
Good morning.
Dr. Kim, what exactly is a brow lift?
Well, a brow lift, basically what happens in your 30s, 40s, and 50s is the brow gets heavy and it just feels, at the first picture you can see of Nicole Kidman, but when the brow gets really heavy, it gets a sense of tiredness. You can see she probably has some Botox, but you can see on the left picture, everything is heavy. She has a very high hairline, very heavy. So that's actually not a great look. And it just feels tired, and you can feel your brows coming down. So patients like that often come in and they need a brow lift. So the incisions we use on the right side, you can see, there's basically two types. One is endoscopic, where we make small incision in the scalp, and two is open, where we cut all the way across. The third, less common for me, is the ones for vision for older patients, where you cut the skin. You can see on the bottom right, the skin right above the eyebrow, you actually cut it out and just sew it up. So that's not really a cosmetic brow lift, that's just for function. But for our discussion, basically the two types on the upper right.
What is the recovery time? I would assume it varies depending on which type of surgery you end up having.
It's usually 2 to 4 weeks of bruising, so it's pretty significant. So patients who are working or don't want to be known, it takes a while for you to actually get rid of all the bruising. So I tell most of my patients, if they don't want to know that anything was done, it takes a good month usually.
Wow. And
yeah.
Is it usually done in conjunction with other surgeries, or is it done alone?
I often do it with eyelid surgery. Often they have sagging eyelids, getting also the brows, so everyone who does this at home, you can really feels good. And so that's a brow lift, basically, elevating the brow. This is the endoscopic technique, and this is the more common one they use in younger patients, usually less than 60. And so we go through several incisions in the forehead and tunnel down and release the brow off the bone. And we use those little, you see those little carpet tacks we actually put into the bone, and we pull up on the brow, and they clip on top of the skin and hold the brow up. So there's no really skin cut out, so the brow lift is a little bit less significant than an open brow where you actually cut out skin. But the hairline generally is not elevated that much, and the downtime is a little bit less.
How long do results like that tend to last?
Usually when you reposition the brow, it pretty much stays there, and then of course you age from there, but it gets you where you were, maybe 10 or 20 years ago, so it's very helpful. In fact, some patients younger in their 30s will have just a congenital heavy brow, so it's nice to get that elevation. It really feels good to do that. And
it can make a huge difference in your appearance, and as we're seeing here from some of these pictures.
Yeah, you can see on the bottom, the upper left, it's an open brow lift, so you can see how it's kind of hard to see on that picture, but his hairline actually elevates. So it's really not good for people with high hairlines, but you can see it opens his eyes. The bottom left is an endoscopic brow lift. You can see how it opens the eyes without eyelid surgery. And of course, the right side, you can see how the eyelid opens just from elevating the brow.
Right.
And really opens up your eyes, makes you feel refreshed, and actually feels better.
And not something that's normally covered by insurance, though, where some eye procedures are, right?
No, the cosmetic brow lifts are not covered. The only ones usually is the one that I showed when you cut the skin above the eyebrows. But it's a very common procedure to do, and really it's a very subtle procedure. We like not to get that surprise look. I had a picture of Sylvester Stallone in my slides, but he walks around really too much. So you have to make sure you go to a surgeon that doesn't want to give you that surprise look.
Oh, there we go. Oh,
yeah.
Oh my.
So you
yeah,
can
you
see that middle picture. You don't want that. I mean, he's a great guy. But you can see that brow is really a little bit overdone, so that's Hollywood for you.
Reason to go to a very skilled plastic surgeon. All right. Thank you so much, Dr. Kim. We'll put this information on our website, WINKnews.com. We're going to be right back. You're watching WINK News This Morning, Southwest Florida's news leader.